Cardiovascular, metabolic, and kidney disorders share mechanistic drivers. They also show a strong epidemiological overlap. To robustly assess the safety and efficacy of Finerenone in patients with a high burden of overlapping cardio-kidney metabolic conditions, the pre-specified pooled analysis FINEHEART was conducted. FINEHEART pooled patient data from 3 Phase 3 studies, Fidelio-DKD, Figaro-DKD, and FINEARTS-HF. Fidelio-DKD and Figaro-DKD were performed in patients with chronic kidney disease and type 2 diabetes, while FINEARTS-HF was performed in patients with symptomatic heart failure and a left ventricular ejection fraction of 40% and above. In total, data from 18,991 patients was analyzed. About 90% of the patients included in FINEHEART had overlapping cardio-kidney metabolic diseases. The characteristics of the populations were consistent across treatment groups. Around 37% of the patients had a history of heart failure. The average eGFR was 59 milliliters per minute per 1.73 meters square, and the patients received robust background medication. In FINEHEART, the primary endpoint was cardiovascular death, excluding undetermined deaths. This outcome definition was derived from the FINEARTS-HF study. The primary CV outcome showed a non-significant reduction in risk of cardiovascular death with Finerenone. However, in the pre-specified sensitivity analysis, Finerenone was associated with a significant reduction in cardiovascular death, including undetermined death. This outcome definition was derived from the Fidelity pre-specified pooled analysis. The treatment effect of Finerenone on cardiovascular death was consistent across all 14 pre-specified subgroups, including SGLT2 inhibitor and GLP-1 receptor agonist use at baseline. This means that the treatment effect of Finerenone was irrespective of the patient's comorbid conditions and initial use of these 2 drug classes. Other study endpoints included a composite kidney endpoint, hospitalization for heart failure, HHF, CV death or HHF, new onset of atrial fibrillation, major adverse CV events, and death from any cause. Here, Finerenone was associated with significantly lower deaths from any cause, cardiovascular events, and kidney disease outcomes compared to placebo. The safety profile of Finerenone is consistent with previous data. The incidence of treatment-emergent severe adverse events was significantly lower with Finerenone compared to placebo. Hyperkalemia occurred more frequently with Finerenone than with placebo, while hypokalemia occurred less frequently with Finerenone. This is in line with previous findings. Hyperkalemia leading to treatment discontinuation or hospitalization was rare. Overall, Finerenone shows consistent benefits across patient-relevant cardio-kidney outcomes, including all-cause mortality, and is well tolerated in patients with a high burden of CKM conditions.